Heart disease is still the number one killer of men and women, and it does seem largely preventable. At least heart attacks and strokes seem like something we can prevent if we start early enough and aggressively enough. What we've learned in the past several years is that the lower you go with your cholesterol, particularly LDL cholesterol or the bad cholesterol, the more benefits you will have. So you have a whole line of evidence, genetic, observational, randomized trials that have suggested that the lower you get your LDL cholesterol and the longer that you have it at lower levels, the lower your long-term risk for heart attacks and strokes. This progression to a heart attack is something that starts early in our 20s, 30s, and culminates in our 50s, 60s, 70s, or older. Starting earlier and being aggressive, you're going to really bring the risk down the most over the lifespan. Statins have been around for 40 plus years now. One of the most, if not the most studied drugs in clinical trials that we have. Consistently, the patients that are on the statin or on the higher intensity statin have fewer heart attacks than the patients on the placebo or the lower intensity statin. They do lower heart attacks and strokes in every trial that we've tested it in. The next most potent medication for lowering risk of heart attacks and strokes, which happens to also lower cholesterol a lot, are the PCSK9 inhibitors. So statin plus PCSK9 inhibitor, you get really efficient removal of the LDL particle from the bloodstream. We see a consistent and significant reduction in heart attacks, strokes, and potentially how long people live. And if you have high risk, well, let's lower the risk factors that we know work. So let's get more aggressive with your LDL cholesterol with those drugs that do lower your risk. Make sure our blood pressure is well controlled. Let's make sure you're exercising, that you're eating a healthy diet. It does seem like we can really impact the burden of heart disease if we start early.